Which of the disorders listed below is characterized by P10 mutation and intestinal hematoma? So this 2 point is important. One is the P10 mutation or P10 gene mutation, and another one there is the intestinal hematoma. So what may be the cause? Here the options are the familial adenomatous polyposis coli, MRCS associated polyposis, Puet-Jaeger syndrome, Cowden disease, and Lynch syndrome. So Cowden disease, it is the P10 gene mutation. So P10 gene mutation in case of the Cowden disease and usually occurs in chromosome number 10, and it is autosomal dominant condition. Actually, keep in mind that any type of structural abnormality, usually it is done by the it is autosomal dominant condition. So the gastrointestinal condition, almost all type of the polyp, almost all type of the genetic condition, they are autosomal dominant. And in case of Cowden disease, there is the macrocephaly develop and multiple intestinal hematoma. So multiple intestinal hematoma and P10 mutation, these two are the diagnostic for the Cowden disease. So Cowden disease, it occurs in case of the P10 mutation and there is multiple intestinal hematomas. And also 89% of the cancer occurs at NES and 16% of the risk of colorectal cancer. That means any site, 89% chance any site, and 16% occurs in colorectal cancer. The Cowden disease, the targeted individual screening increase risk the breast cancer, thyroid cancer, and uterine cancer. So the Cowden disease, it is risk factor of the breast cancer, also risk factor for thyroid cancer, and also risk factor for the uterine cancer. So in case of Cowden disease, this cancer also may develop. And Cowden disease, there is multiple hematomas syndrome, autosomal dominant condition, and the clinical feature, multiple tumor-like growth or hematomatous polyp, oral or mucosal papillomatosis may also develop, acral and palmar-plantar keratosis may develop. So in case of P10 mutation and intestinal hematomas, they are the diagnostic for the Cowden disease. On the other hand, in case of familial adenomatous polyposis coli, it presents more than 100 polyp in colonoscopy. MRCS associated polyposis, usually not this condition. Puet-Jaeger syndrome, there is also blackening or there is the blackening spot around the mouth. And Lynch syndrome, usually the right-sided colon cancer. So P10 mutation hematoma, this two combination is the diagnosis for the